today. And let me just tell you, there's a couple of, what we're going to do today is we're going to use BOTOX, which is a neurotoxin, to help relax some of his strong muscles that he has. Now, he's already been following a really great regimen and coming in every 2 to 3 months for his BOTOX. So take a look at him. It's a part of the reason why he looks so good, but honestly, the other part is genetics. He's just a very attractive guy. Just look at this. We are working to enhance these features. Now, remember that we're using BOTOX, so we do have other neurotoxins that help to relax the muscle. And a lot of time, my friends will ask me, what's one treatment that I can do that you don't even have to think about, that you recommend for your family, your friends, clients? It's always it's always something like BOTOX or Dysport or Xeomin.
How much do you charge? They're asking. They already want to know how much you charge.
So I charge, come see me down at the office.
Wait, it's got a bad connection.
Bad connection? Oh my goodness. Come on, guys.
One second.
Who's messing up our connection?
We're back. There we are. How much do you charge, Niche the PA?
So I charge $12 a unit for BOTOX. Now, remember that is
how many units are needed for a full face, they're asking?
So typically we're talking about neurotoxin. Let's say, for example, BOTOX. There are a couple of units. A part of it is going to depend on the person and how strong your muscles are, but standard is 20 units to the glabella, which is this part here, frown down. Awesome. That's this part here that wrinkles this part of your forehead. And then lift your eyebrows. Typically 20 units to the forehead. And then we're talking about around the eyes. I'm going to turn to the side. 12 units here around the eyes on either side, so 24 units in totals. That's the standard BOTOX dosing, 20, 20, 24 around the eyes for the typical person. You may need more if you have very strong muscles, and you may need to come in frequently, typically patients like 3 to 4 months, but if you work out very frequently, like my client here works out a lot, he has to come in a little bit sooner, like more on the 3-month side than the 4-month side, and we're gonna keep him looking nice and young. Now, this is a very simple, quick procedure in the office. Let me show you how it works. I'm going to have you frown. Good. And then relax. Perfect. And we're going to do a little poke here. It's going to have little blabs underneath the skin. Get a little bit of a gauze. Perfect. And then frown. Good. Relax. So it doesn't really hurt. And what you're going to notice is these little bumps that form. That's just a medication under the skin. That's going to go away literally in the next 10 minutes. So that's the glabella. Now we're going to move on to the forehead. And the reason why we're doing this is because, as you can see, he's been very consistent, so we only have a little bit of lines here that you notice. Raise your eyebrows again. But if he didn't give BOTOX, these lines that you see with movement will start to sit in, and it would always have these little creases here, even at relaxation. All right, I'm going to have you raise your eyebrows one more time. Perfect. Relax. Little pokes underneath the skin. Turn towards me a little bit. Perfect. And raise up your elbows one more time. Perfect. Relax. And I always like to do a little bit above, back here, up here on the hairline, because sometimes you'll have a little bit of movement back there. And then to the other side as well. Perfect. So now we've treated the glabella, we've treated the forehead. Last but not least, we're going to treat around the eyes. Now, some people refer to these as crow's feet or laugh line, smile really big. And you can see we're going to help to just kind of calm these little lines down just a little bit. So little pokes here. 1, 2, 3. Very superficial underneath the skin. And this is probably where you're going to see those blebs at a little bit more. 1, 2, 3. Perfect. And then let's turn the other way. Awesome. I'm going to go ahead and wipe them off a little bit. Now remember, when it comes to your neurotoxin. This is gonna take about 10 to 14 days for everything to kick in. You wanna make sure that you don't massage the area because we don't wanna massage that medicine out of the place that we're trying to treat. And then in 10 to 14 days, all of these lines will soften. Some of them will erase completely. The movement will get softer. And that's gonna overall help hit the texture of his skin. Now, if you say, Nisha, but what else could you guys do for him? I mean, he's the easy case. We would just do some resurfacing lasers to help improve his texture, to make sure his skin just looks amazing as he continues to age, which is very natural. Now, if you guys have any questions, you want to get in touch with myself, you want treatment in the office, or maybe you just want to start with a virtual or in-office consultation, you know how to get in touch with us. First name, last name, email address, slide into the DMs. Until then, it's Nisha the PA at Dr. Emer's office. I'll see you guys then. Bye, guys.
That was awesome.